When I want to evaluate a child who has been referred for possible attention problems or ADHD, my first request is that they must fill in forms, they fill in questionnaires. These questionnaires is very important because this is the basis of the diagnosis. In fact, in the United States, this is almost the only basis of the diagnosis, is the questionnaires, where we base the questionnaires based on what's called the DSM-4, now the DSM-5 criteria, where we have 9 criteria of inattention and 9 criteria of impulsivity and hyperactivity, and it's important that there be at least 6 of each of these symptoms. And it is sort of subjective because one teacher or one parent might see it much more severely than another one in the same kid. So sometimes it's difficult to gauge. I prefer using questionnaires that are a little bit more elaborate than just 9 questions in each category. For example, I prefer to use what we call the Vanderbilt Questionnaires. The Vanderbilt has about between 34 and 46 questions, and it has the 18 categories of the DSM, the Diagnostic Statistical Manual of the American Psychiatric Association. It has also questions related to oppositional defiance, conduct disorder, and things related to emotional function, depression, anxiety, and you can pick up on some of these things which are comorbid, that appear together with ADHD or might be confused with ADHD. So it's important to see this, to see to what extent there's an interaction between these different things. And of course, there's questions about the child's academic functioning. So these are all important things to have, both parent and teacher questionnaires. There's also, I must mention, the Connors. There's the Connors questionnaires, which are also excellent questionnaires. But the questionnaires is really the basis. And then once they come with the questionnaires, either they send it to me in advance or they bring it, and then I'll invite them to come in. I ask them to bring any additional diagnostics that they've had, if they've been seen by a psychologist or a psychiatrist, if they've had other paramedical evaluations, I ask to see that. And then I see the child. I'll take a child anywhere between an hour and a half is my evaluation time, depending, but I feel that minimum of an hour, less than an hour, I feel you can't really diagnose ADHD properly. In this session, I will go over the questionnaires, the forms. I will, and then I will, of course, while the child starts doing things in the room, I interview the parents and take a careful history. You take a developmental history, a medical history. How was the birth? How was the pregnancy? How is of course, as we said, prematurity is a risk factor, for example. And then I do I use Mel Levine's developmental examinations. There's, for example, the PEAKS, which is the Pediatric Early Elementary Examination. And what it is, it's a screening test that's used by doctors where we can pick up on various learning functions. For example, his visual and his auditory memory, his active working memory, his ability to remember things by rote, his language, various things we check up on, his ability to think sequentially, in orientation in space and in time. And these things are important. I also will often ask the child to read a short segment from a book to something at his age level, and then see his reading comprehension to get an idea of where he's doing academically because of the sometimes confusion between a pure academic problem and an ADHD problem. After I do that, which takes something like 20 minutes to a half hour, I then do and of course I examine the child and make behavioral observations, what he's doing in the room, how is he sitting, is he able to sit, is he able to focus, is he, his eye contact, and his interaction with the parents, his interaction with me. And then after that I do a full physical and neurological examination, which takes another 10 to 15 minutes depending. And after that I then look over all the material, and usually I can then give at least an initial diagnostic impression, depending on how much information I can then get from what I've gotten in the room. And then based on that, I will then make a treatment plan and decide how to continue with this child. What I found is, if the case is clear-cut ADHD, the questionnaires are clear-cut. I see the child's ADHD behavior. I often, and especially in the child between the age of, say, 6 and 10, 11, I often may not need to do a computerized testing, because if it's so clear-cut, then I will not need to go on to another further computerized testing. So I will often use it, especially if I want to distinguish between the child to see whether or not it's coming more from the learning problem or the attention problem, and see if we can try to isolate the attention problem. So the computerized testing really helps me with that. And of course also distinguish between an emotional problem or behavior emotional problems from the psychiatric point of view as opposed to ADHD, and the computerized testing can often help us with that. Now, the children over the age of, say, 12, the story is different, because we found that the questionnaires are really not good enough and not adequate, and especially since a child who hasn't yet come to diagnosis at that age, often what will happen was the teacher will fill in the form, this may happen at a younger age as well, in a way to try to persuade or try to persuade somebody to give medication. So because of that, we are wary of that, and I think that over the age of 12 it's almost necessary to do a computerized testing, and therefore I will often recommend before they come in over the age of 12 to have the computerized testing done before. But like I said, between the age of 6 and 12 it depends on the case. If they do it in advance, that helps me with the diagnosis. If they haven't done it, I'll order it depending on the case. I also do what's called, I have in my private clinic, I call it an integrative diagnostic session, where we do the MOXO together with a complete clinical workup, together with the questionnaires, and then you come up with an overall diagnostic picture, which I think is actually very excellent. It really gives a good overall picture, and I think that for parents who are interested in that, I will definitely recommend that as a even a first choice, perhaps a first choice to do in a diagnostic workup.